Well, that's a good question. There are alternatives to inhaled, both the inhaled, the combusted. When I say combusted, I'm using fire, rolling up a joint and lighting it up, or loading up the product into a bong or pipe and then using fire to it. So that's one form of inhalation, or vaporizing the oil, which is the other form of inhalation where you get sort of those peaks. Now, one of the alternatives would be to do a sublingual, meaning below the tongue preparation of cannabinoid therapy, be it CBD heavy or a THC containing mixture. And one of the great advantages with that is that you get very rapid absorption. There's a very vascular capillary bed of very small blood vessels, but very many of them right beneath the tongue and around the gums. So if you were to apply a cannabinoid based oil, in an oil vehicle, and hold it under the tongue for 30 seconds to a minute, you'd also get that absorption without having to factor in the effects of taking in smoke and the possible irritation from taking in smoke. Because any way you inhale cannabinoid medications, it can always be the THC itself, in addition to the smoke or the vapor itself, can be irritating to the lungs. So it's important to remember that you can get these cannabinoid medicines by a number of routes. Okay, so under the tongue is one route. Hitting the digestive system directly is another option. Now, I have my personal professional feeling on that. I don't think that going to the gut with cannabinoid medicines is the best option for a number of reasons. The first of which, the stomach acids are going to chop it up. Then it's going to be acted on by the liver enzymes to make it available to the bloodstream, and all of those things take time. So there's a longer lag time. It's important to remember that the absorption of cannabinoid medicines is going to be longer and less efficient and less predictable when edibles and things like that are taken via the oral route. So when you consider the oral route of administration of edibles, what have you, you have to factor in a number of things. The economic impact. I always like to talk about cost. I don't think I talk about it a whole lot, but if you're not preparing your own edibles and you're purchasing them from a dispensary or what have you, it's A, going to cost more because it was prepared. B, these things are not likely to be healthy. I'm sure healthy edibles can be made, but for the most part, these are candies and that sort of thing. So you're looking at increased cost. The other overarching thing is the inconsistency in dosing. Okay, so if you were to even have a predictably dosed edible, say where you had a 5 milligram serving of THC, you could take that same 5 milligram serving one day and have a certain type of effect, say a really strong effect, in about 2 hours after it's been digested and acted upon by the stomach and the liver, and then now in your bloodstream. You could have a very strong effect one day, and then the next day, depending on how well you hydrated, how much you ate, and a number of other factors, many moving parts, you could have that same 5 milligram dose and take it the next day and have a completely different effect, either strong or weak or what have you. It's not predictable when you go via the oral route. Dosing is imprecise. You can always get the most precise dosing to get a predictable effect when going the inhaled route. If you can withstand the inhaled route without adverse reaction, and if that's not an option for certain patients, I'd say the next best thing, safest and in terms of side effects and predictability of dosing, sublingual route. I very, very, very much do recommend. When we're talking about the sublingual route, we're talking about tinctures, oil-based things like that. You can get some certain water-soluble things, and these are done beneath the tongue. All right, that's the important thing to remember. You don't want to put it on the tongue so you swallow it. You want to lift up the tongue and get these liquid drops placed beneath the tongue. And after you place it beneath the tongue, you don't want to instantly swallow it. You want to kind of just let it swirl around there. Even if it swirls around in the gum, between the gum and the lip, under your teeth, that's also good. It's just a very vascular bed. A lot of tiny blood vessels that absorb things very quickly and easily. Things that are in a lipid vehicle, things that are in a fat-based vehicle, absorbed through those lipid-based cell membranes. The blood vessels have cell membranes that are also lipid-based. So if you put it right there on top of that rich, very vascular blood vessel bed beneath the tongue, you get very rapid and predictable absorption and dosing. You're ready to get that quick high euphoria? Inhaled always. You're looking at either vaping or smoking, all right? And I come back to people always kind of use smoking together with vaping. Just to be clear, when we're talking about the inhaled route and the vaping and the smoking is when you take the dried flower and you're gonna apply fire to it specifically and burn it up and inhale that burnt smoke, versus a thing like vaporizing, where you can either vaporize the flower itself, apply heat, essentially like an oven, just applying dry external heat, melting the trichomes. All right, the trichomes contain all of the oil. The trichomes are little frosty heads. Okay, the trichomes are the thing that give you the keef. Anytime you're talking about keef, what you're talking about is just all of the trichome resinous heads. All right. So essentially, when you're talking about a heat vaporizer for the bud, you're talking about just melting those very cannabinoid, oil-rich trichomes, melting that keef and making it into a vapor. And when you vaporize the dried bud, what you're doing is inhaling that melted keef trichome cannabinoid vapor. Okay? So by the same token, when you're talking about the vape oil pens, all that's happened in that process was essentially the trichome heads, what's called these capitate trichome heads. When I say capitate, I don't want to dig too much into the $10 words, but essentially think about, a bulbous head on a stalk, a head on a neck. If you look at trichomes under a microscope, you'll see that there's a neck attaching it to the actual flower, then the head where all of the good stuff is contained. So what happens with these vape pens when you get a vape cartridge, essentially what you're getting is that trichome head oil with all of the THC and CBD and all of the whole suite, the whole entourage of cannabinoids. They're pretty much pressed into an oil, removed from the flower and pressed into an oil. And when you have an oil vaporizer, what it does is it applies heat to that oil and melts the oil and turns that into a vapor. So you're inhaling the vapor as opposed to, you're inhaling oil vapor as opposed to inhaling smoke from combustion from heating the flower and inhaling that. So my long-winded answer to your question is looking for the fastest onset of action from marijuana medication. It will always be inhaling. Time to action will vary, but you're looking at about 5 to 7 minutes for time to action, and that's just a guesstimate. Really, in all honesty, I believe it's sooner. Depending on how much you take, it can be sooner. So that's time to onset, but remember that a lot of the effects, what's considered the actual peak of the high, might not come for another 45 minutes to an hour. And the nature of the high can change over time. It can be activating at 1 second and introspective at another point. And at some points, depending on the dose and the cultivar, meaning the breed of weed, at sometimes the high can even be uncomfortable or disorienting or edgy. You think you feel good, and then all of a sudden you say, I feel a little bit edgy, and not combative, but not in a happy, relaxed, calm place. So anyway, that's me.